How do you know your friend doesn't have the new strain of the mpox virus disease? Yes, a new strain of the mpox virus, initially called monkeypox, mpox 2024, clade 1b, has been identified, which is more virulent than mpox 2022, the epidemic that came up in 2022, about 2 years back. The World Health Organization declared a global health emergency in August this year, 2024. Now, the new strain was identified in the Democratic Republic of Congo, which had over 15,600 cases and over 500 deaths this year, and it's spreading fast. I mean, like really fast. 2 years ago, an international emergency was declared. However, the new strain this year is said to be more virulent than that in 2022, about 2 years back, which this new strain now is the mpox 2024. This mpox is clade 1b, and it is regarded as a mutant of the previous virus. Remember, there was an epidemic in 2022, and this one now is spreading even far more than that in 2022. Now, mpox is a contagious and infectious viral disease. Nigeria has the highest reported cases, above 840 cases in Nigeria. Nigeria has the highest reported cases in Africa. It has above 840 cases as of 19th May 2023. Then it was followed directly by DRC, which had about 739 cases. Then Ghana, which had around 27. Then followed by the Central African Republic, which had about 30. And Cameroon, which had about 29 cases. But this year, over 121 suspected cases have arisen since September 2024. Over 121 cases. So the question is, how do I know who has this disease? Coming up, we usually know who has the disease through the signs and symptoms. Now, typically, these signs occur within the first 7 days. It may occur within the first 7 days to 1 month. That's about 4 weeks from exposure to the infectious agent, which is a virus. So once somebody has been exposed, it takes about 1 week to 4 weeks, 1 to 4 weeks before the symptoms start showing up. What are these symptoms? Person may have headaches, may have fever, may have fatigue, tiredness, may have a backache, and then there's a rash, a typical rash. All these, and even a person may also develop the sore throat. All these are some of the symptoms that one may start to notice, and that will tell you that there's something wrong and you need to go to be tested. Now, it is important to know that people who have a reduced immunity, like HIV patients who are not on medication, pregnant women, children, or people who are on immunosuppressive drugs, are at higher risk of coming down with serious complications from this disease than the ordinary population. So these set of persons may benefit from an increased level of awareness and protection against such diseases, so that they are not adversely affected. Now, the rash from the mpox virus usually starts from the face, and usually it's a flat rash, and then it develops and becomes filled with fluid, which we call a vesicle, and then with time it now becomes filled with pus, which we call a pustule. So this rash gradually develops. It starts from the face, then moves to the body, the chest, and then the back, then may appear on the palms and the soles of the individual, and it could be itchy or painful. And this rash usually occurs within the first 1 month of infection. So it is important to note that people who are immunosuppressed, who have a low immunity, like HIV patients who are not on medication, pregnant women, even children, these people should be given attention as to preventing such infections, because it is worsened in a situation where there is reduced immunity. And because the awareness, many people are not even aware of this virus that is spreading so rapidly. That is why you see a number of persons are pretty much careless about their interactions with other people. So this video is just to create an awareness that there is something like this going on. And in Nigeria, we've had suspected cases and a few confirmed cases. So it is very important for everybody to be careful and be conscious of the presence of the Mpox virus disease. So the question now is, how do we prevent this? How do we prevent this? Number one, regular hand washing. Regular and frequent hand washing. Wash your hands immediately you come back from work. Many people, you go to work in the morning, you come back in the evening, and the first thing you do, you are using the same hands to greet your kids, carry your kids, and so on. Once you get back home, it's good habit to go wash your hands first before you touch things in the house, because it's a way of decontaminating yourself. Some people even take a shower. Like me, once I get back home from work, I just take a shower. That's even much better, because in that way you're washing your whole body. So wash your hands regularly. That, if you do regular hand washing, that takes care of over 50% of transmission of most contagious diseases and infections. So wash your hands regularly. Number two is avoid skin to skin contact. Most times during the first week, most people could maybe asymptomatic, meaning that they are not showing any symptom. You may think that they are normal, they are fine, but then they have the virus. So avoid skin to skin contact, especially when the person has developed a rash. It is easy for the infection to be transmitted from one person to the other. So avoid skin to skin contact. Avoid exchange of body fluids like saliva, blood, and so on. So avoid kisses. Things like kissing can also transmit the infection, because the virus is known to be present in the body fluids of infected persons. Now, it is also important to note that the Mpox virus infection is also a zoonotic disease, meaning that it can be transmitted from animals to humans, meaning an infected pet or an infected animal, if eaten or if touched, the disease can be transmitted from that animal to humans. So avoid contact with suspicious animals or pets, and avoid eating contaminated meat. Another way in which this infection can be transmitted is through exposure to what we call fomites. When you cough in public, you always need to have a handkerchief around so that you don't spread respiratory droplets about and get others infected. So, and also you too, when you see somebody coughing around you, you have to leave the area or make sure that the place is well ventilated. Make sure that the place is well ventilated so that cough droplets and respiratory droplets which carry the virus will not be transmitted to you. And ensure that when you sneeze on surfaces, you wipe them with sanitizer or methylated spirit so that any other person touching that surface would not be carrying an infection. So protect yourself and also ensure you also protect others. Now, one other protective measure that comes handy is, remember during the COVID-19 era in 2020, we conquered it mostly by hand washing and social distancing. Now, the Mpox virus disease is a disease that can be prevented too by effective social distancing, meaning when you notice a suspected case or you notice someone may have the infection, it is safe for the person to be isolated. It is safe for you to have a safe distance, a safe social distance between people, between persons. Not too close contact. Avoid too close contacts where the droplets from one person can easily reach the other person. So the social distancing will help us a lot in this disease prevention, because the Mpox virus is spreading fast and there is no known treatment for now, no known cure for now. Yes, some antiviral agents which are effective against the smallpox virus have been said to be used against the Mpox, but the efficacy is not 100%. It's not a sure cure. So it's better to prevent it than to cure it, because for now there is no cure. So social distancing, and for those who have been infected, they should be isolated. So if you have the infection, it's better for you to be isolated in your family so that you don't pass it on to your children. Do you understand? So that you don't pass it on to your children or to your loved ones. So isolation if for infected cases. Now, as concerning treatment, like I said, there is no known treatment. So there is no known treatment. So it is best for everyone to prevent getting infected with this Mpox virus disease, because there is no known cure. A post note, also know that the smallpox virus vaccine, those who have been immunized or vaccinated for smallpox have some level of immunity, although not 100% immunity, meaning that we've seen people who have been vaccinated for smallpox still come down with the Mpox virus. However, it is said to have some level of immunity for some persons. But most of us were not vaccinated, because at some point smallpox was eradicated, so the vaccination stopped. So many people have not received the smallpox vaccine. However, if you receive the smallpox vaccine, there is said to be theoretically some level of protection for such persons. So, however, the gold standard is to implement or carry out the preventive measures we've said, which are regular hand washing, social distancing, and avoid skin to skin contact, and avoid eating infected animals, avoid touching infected pets, because these are ways in which the virus can be transmitted. And once a person is infected, ensure the person is isolated. Ensure you isolate yourself. Once you feel fever, headache, you feel tiredness, you feel you're unwell, you just feel unwell generally, and you feel you have a sore throat, or you have a backache, you go to your health center and get tested. A test which we call the polymerase chain reaction, the PCR, will be done for you to find out whether you really have the mpox virus, because there are many things that can cause rashes, not just the mpox. So it's not just about anybody that has a rash has mpox. No, you have to also be sure that it's mpox. That is why you need to get tested. So see your doctor, and your doctor will advise you. So if you like content like this, do well to watch my other video about ways on how to take care of your health. Your health is our primary concern. Stay healthy and don't mess things up. If you like contents like this, do well to smash the like button and turn on your notification so that you will get notified each time I post a new content. And subscribe to this channel as a way to support us and the work we do, as we're out to feed you with information that will help you take charge of your health and don't mess things up. I see you in my next video.